When I left the hospital floor for a laptop screen, people told me I'd lose my edge, but they were wrong. Today, I help healthcare systems use big data to save lives, and I earn more than I ever did at the bedside. Healthcare is shifting. We're moving away from fee-for-service and toward value-based care, where outcomes, not procedures, drive revenue. But with more data comes more regulation. New laws like the EU's AI Act and US HIPAA updates are tightening privacy controls. That's created a goldmine of opportunity for clinicians who know how to make data work for patients without compromising privacy. Here's the kicker. You don't need to be a programmer to lead this revolution. I used to think big data was just code and dashboards. Then I joined a project helping a health system manage diabetes using patient analytics. That one project paid $20,000 in just 6 weeks. The truth? Your clinical experience is the secret sauce. Every shift you worked, every patient you advocated for, that's the training data big data systems desperately need. According to Health IT Analytics, value-based care programs using big data cut readmissions by 25%. The OECD says 70% of developed healthcare systems are shifting to value-based models. The UK NHS is investing £1 billion into data-driven care by 2028. In Pakistan, big data powers rural care initiatives. But without clinical eyes on these systems, tech risks missing the point. We need people who understand workflows, who spot when patient trust is at risk. That's what I bring to every project, and it's what you can too. Let's talk about you. Your superpowers as a clinician, pattern recognition, ethical vigilance, empathy. Those are exactly what data teams need. I turned those skills into a consulting career. My first contract, $15,000 in 1 month. Year 2, over $200,000 annually, and total professional freedom. No more 12-hour shifts, no more watching broken systems fail patients. Just real impact on your terms. Leaving the bedside felt like betrayal. I thought I'd lose my identity, but I didn't become someone else. I became a more powerful version of who I already was. I learned HIPAA, GDPR, and AI policy basics online. I pitched small data projects and I never looked back. So here's the choice. You can stay in a broken system, or you can reimagine care at scale. Learn privacy, learn the basics of big data, bring your clinical brain to the table. Drop a comment if you're ready to make the leap. Like this video if it resonated. Subscribe for more insights from the front lines of digital health. I'm Rod Lee, your digital health narrator and Coach Rod's digital avatar. And this is your invitation to step into the future